Finding access to care for mental health issues can sometimes be a lengthy process. Today, the Pere School District is introducing a new tool to help address those concerns. Emily Riley spoke with academic administrators spearheading this effort.
Right.
A typical student in Pere interested in accessing care for their mental health could see wait times of 3, 4, even up to 8 months before booking an appointment with a professional. Chris Thompson, the superintendent of the Unified School District of Pere, says timely access to care is essential and is heightened by effects of the pandemic.
That sense of isolation had a negative impact on building that sense of belonging, that sense of continuity and community and support, because you didn't feel you were able to access.
Thompson says 3 consecutive days of community conversations help them prioritize student needs by hearing directly from them.
All 13 of the tables and groups listed in their mads, sads, and glads that they were mad and angry and frustrated about the unmet mental health needs in our community.
In response, Nicholson implemented Care Solace, an online portal that navigates the mental health care system to find available providers matched to specific needs. It will ask user questions to match them to mental health care best suited for them, such as if they have insurance, what issues they're dealing with, and the kind of service they want to receive. Any person using the software remains completely anonymous.
We're talking about just getting connected to the services without having to make 30, 40, 50 phone calls themselves or wait for months and months and months to get the help.
Other districts like Howard Suamico and Ashwaubenon are also using the program and have reported shorter wait times. Anyone living in Pere or a surrounding area can access the service under the Pere School District's website under the Families and Resources tab. In Pere, Emily Riley, Action 2 News.